Welcome to Not Your Ordinary Parts, a podcast where we talk about hard things associated with the human experience with the goal of increasing awareness, growth, and healing. You may hear information from professionally licensed therapists, life coaches, healers, doctors, etc. This information is not medical advice or therapy and is not meant to replace actual therapy or instructions given by a doctor or personal therapist. I'm your host, Jalon Johnson. My guest today is Dr. Calvin Fitch. Dr. Fitch is a Harvard trained clinical psychologist with over 10 years of experience. He completed his undergrad degree in psychology at California State University, Long Beach, and earned his MS and Ph.D. in clinical health psychology from the University of Miami. Dr. Fitch has used his advanced training and expertise to secure over $1 million in grant funding. $1 million in grant funding, and he's an author on several peer-reviewed publications in the area of behavioral medicine and public health. Dr. Fitch specializes in anxiety, depression, and chronic illness and offers his clients a challenging and supportive atmosphere to help them embrace the unique aspects of themselves, achieve their therapy goals, and successfully navigate sometimes invalidating world. Got a little tongue twister there. Sorry about that. So, welcome to the show, Dr. Fitch. Thank you so much for being my guest.
Thank you. Thank you for inviting me. I'm so happy to be here and been looking forward to this. So,
Likewise. Also, I gave a brief introduction, but so that the audience can get to know you a little bit better, would you mind giving us a little bit of background about yourself and how you got to who and where you are today, please?
yeah, absolutely. So, I am a licensed clinical health psychologist. So, I am from California originally, Oakland area, and I went to Cal State Long Beach, as you mentioned. Started out like pre-med. I was like, I want to be a doctor. I'm so interested in helping people. But through a series of things and like stuff that happened in my own life and just changing interests and passions, which I'm sure we'll kind of talk about later, I ended up taking this health psychology class because I was just like, oh my God, cleaning out bedpans and like, I don't want to do that. So maybe you're not that passionate about being a doctor. Maybe you need to switch fields. So I ended up taking health psychology, like fell in love with it. Like, oh my God, this is how you can blend. Because there's more to the picture than just health, right? Like there's our mental and all of that. And so that was a great way to blend that. Those two things, and then decided, I want to start my PhD. Like, I want to go for it. And those were the programs that were funded, so you didn't have to pay that high tuition. And this brilliant Korean woman who was on faculty there recruited me to be in a program that helped to get underrepresented groups into doctoral programs. So did that. Applied, ended up going to University of Miami, trained there. I was doing a lot of work with helping gay and bisexual men in Miami with kind of processing different traumas, including minority stress, childhood sexual abuse, and was really interested in that work. And it was more from the side of like public health and helping to decrease risk for HIV. Because we know there's that connection between people putting themselves in situations or getting into situations that might increase their risk for HIV and also like mental health. So did that, and then I was like, I really want to kind of work with my people. Like I want to work specifically with Black, gay, and bisexual men. So applied to an internship at Harvard. A lot of people were doing that kind of work there, a lot of big names, and was doing that for a while, started doing my postdoc there as well. And that's where I started kind of getting grant funding to do this work and to kind of learn about the experiences of gay and bisexual Black men, experiences of homophobia and racism kind of intersectionally. In order to design like a therapy program that would kind of address those things. And then I just kind of like got to a point where, it was just the passion for doing the research end of it and all the bureaucracy and kind of
Mm.
feeling like I was, you know, sometimes like having to defend myself against attacks from, just against my self expression and things like that, got me to start thinking like maybe academia isn't the place for me. And so this year, actually, I kind of left academia, started leaned more heavily into my private practice, and I've been doing that ever since. So, yeah, and here I am, kind of, and now I've kind of circled back, and I'm designing this like e-course that I want to, kind of be able to give to Black, gay, and bisexual men, because there aren't just a lot of tools out there that are tailored for us. So, um, yeah, that's where I'm at.
Thank you for that. Thank you so
Mm-hmm.
much. I remember when I first reached out to you and I saw, I think it was a video about social anxiety, and the way you broke it down, I was like, oh my goodness. Like it was, I mean, we know about social anxiety and we know about anxiety, but it was just something about the way you like broke it down. And I was like, wow, that was really good.
Yeah.
And I decided to reach out. And then when we decided to do this together and to connect, it was really important for me to use this as an opportunity to discuss difficult topics, uncomfortable topics, and we both agreed that we were up for the challenge.
Mm-hmm.
And I think having the opportunity for two Black men to sit and talk about trauma and cultural burdens and just all the things that we may not have an opportunity to talk about. Like you said, even when you were in academia, you felt like you were being attacked for your self expression. There may not be opportunities to talk about those things or to really shed light on them because it's just the norm, you know? So
Mm-hmm.
this was a big conversation for me and I'm glad you agreed and I'm glad you're up for the challenge. And that being said, I think that we should get right into it if you're up for
Yeah, let's go. Ready, excited.
it. Me too, me too. Um, Culturally, I think it's safe to say that therapy and Black people for a long time were like oil and water. I don't
Mm-hmm.
think that that would be doing an injustice at all in saying that. It just wasn't a thing. And I think it's because our parents and grandparents didn't have a lot of tools or resources to manage their emotions, to manage the effects of past and present traumas. They were surviving more so than living and had to navigate existing in a world that didn't afford a lot of opportunity because of their skin color. And because of that, there was a lot of dysfunction and unhealthy patterns that developed. And that became the norm. And they also did an amazing job with the tools and resources that they had, even though they didn't have a lot and their circumstances, marginalized them and limited them to what they could do. Not many people could have gotten to where we are given those circumstances. So those two things can coexist. And I don't think one cancels out the other.
Yep.
Um, so what I'd like to do is start the conversation centering around these types of cultural burdens and also allow the audience to have an opportunity to hear your story because not only are you a Black man, but you're a gay Black man. And I'm sure that that has presented some undeserved challenges as well for you.
Yeah.
Um, and I know that right now you don't live in the United States anymore, and we'll get to that. But I wanted to ask a few questions to open the conversation
Yes.
regarding your experience growing up in the United States. So
Mm.
I know that was a mouthful too, but my first question is what was childhood and growing up like for you? And did your family offer you the safety to be authentically you?
Yeah. So like I said, grew up in Oakland. So, large Black population there, very prominent. And I was raised by all pretty much women. My mom and my aunts. I had a stepdad for a while, and he was involved. But I think the bulk of my influence sort of came from the very strong women that raised me, grandma included. And I think that my family really did, like, I think they offered the space for me to be me, but it was the outside environment that wasn't my family that felt more constricting. Um, and this question is so interesting because as I said, I was working on this e-course, and I was just thinking about some of those early experiences that we deal with sometimes as, being Black, that sometimes can have this function of helping us to survive on one end, but on the other end, it kind of creates this little sense of shame and like makes
Mhm.
you feel like you need to hide certain aspects. So one of the earliest examples I can think of is like code switching, right? So like hearing my mom normally, talking with family, friends, me, and then she'd get on the phone and like, have to talk with, somebody for business or whatever. And it was like this completely different voice. And I'm just like, what? Hello. What is this? And over time, kind of learning, my mom was a big stickler for like the way that we spoke. My sister and I, careful with using a lot of slang and things like that because people will treat you differently.
Mhm.
When I call, you hear me speak like that because we won't get this situation resolved unless I
Sound a
speak a
certain
certain
way,
way.
yeah.
Exactly,
You gotta
and
use your
it's
white
like,
voice.
yeah, the white lady telephone voice. Exactly, that's what I call it. And kind of experiences like that. Um, and that was kind of maybe more related to being Black, but then there were things, related to my just self expression, even before I knew I was gay, right? Like, so my mom loves to tell stories about how, like, I didn't want to play sports, I wanted to play house with the girls. And, like, I always wanted to be the mom or the sister. Like, I didn't, I didn't want to be like the brother or the dad or something like that. And I don't think there was ever any like real, um, kind of like, oh, you need to be more, manly or anything like that from them. I think there were questions sometimes
Mhm.
that made me feel like, oh, what I'm doing is not, it's kind of out of the norm. Like, oh, how come you don't want to play the boy character? Or, that kind of thing. But yeah, I never felt like it was something where, I was being criticized. Maybe more by my stepdad. I think that was something, getting involved in sports. Oh, you should be doing this and stuff like that. But I think some of what I was getting from the women was kind of protective a little bit against some of that. Um, but then I can remember too, just outside of just those identities, is like we had a time in my life where like we were kind of unstably housed. So we were living, staying with my grandma to be able to go to school in a certain district. But
Mhm.
then, like, we were living in like hotels sometimes and stuff like that. So, um, and I always had to hide that. Like, so you think about, when you're in school and kids and like, oh, can I come to your house and stuff like that? And I had to like hide and say like, no, and come up with all these different reasons. I couldn't let anybody know, where I lived. And actually one day I ended up getting found out like by somebody, an administrator at the school who like cornered me and said like, where do you actually live? And da, 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 da. And ended up getting like kicked out of school. So like the whole
Oh,
back end of eighth grade, like I wasn't able to like, graduate with my peers and stuff like that. So it was quite a thing. And then, fast forwarding to high school, I think I was starting to realize a little bit more that I had, more of a romantic interest maybe in men, and feeling like I might be gay, wasn't quite sure, but, I you see there's this like vicarious trauma when you're looking at, people being kicked out of their homes, seeing kids in school beat up or harassed for any behavior that's not like heteronormative. And so it made me really start to like close in, and especially with romantic aspects, not, I missed out on all that, even though I don't think you learn it all in high school, but there is a certain things that you're exposed to that I just did not get. And, this idea of like hiding things, about myself, again, this like kind of like recurring theme, and this fear of kind of like sometimes being outed or found out or thought of as gay because I might be beat up or, harassed
Mhm.
or kicked out of my house like I had seen.
Sure.
Um, and, I think at the end of high school, I got kind of sick of like hiding, and I was just like, I can't do this or live this life anymore. Like, I'm going away to college. Maybe this is time to like start anew. And so actually ended up deciding to take a boy to prom and came out to my mom on like prom night with my date like waiting in the lobby because I like procrastinated so long that like because I had made other arrangements in case like my mom kicked me out of the house or something like that, like
Oh.
but ended up coming out, and she was she was very like accepting. I think I had like I knocked on the door and I was like, oh, and I was supposed to bring my date, and they were like, oh, where's your date? And I was like, he's out in front. And they were like, well, why don't you bring him in? And I was like, oh, so it's a boy, right? They were like, yeah, yeah, so you can bring him in. And we took pictures and like did the whole corsage thing as if it were a girl.
Mhm.
Um, and I think, that ended up being a really great experience. But it's kind of, while my family was accepting of me, I think there's just kind of always been this theme of like external messages that, and things that I've seen of like, you're not going to be accepted, and this is what will happen if you're not accepted. So you need to hide these aspects. And I think over time, sometimes it can become like the go-to behavior. The brain just defaults to that, right? And you know, and I think that's what racism ultimately wants, right? Is for you to hide and be invisible and not say anything. And so, um, I think I've kind of devoted my life to try to like fighting against that. So
Thank you
that
for
was a
that.
I hope.
No, but still, it was good. It was good. Thank you. I mean, the fact that on prom night you decided to come out and that your family
Mhm.
was accepting of it, but you had already had plans, like backup plans in case you got kicked out of the house. So that, I mean, that just goes to show the amount of stress and trauma that can be associated with being authentic.
Mhm.
And there's layers to it, especially as far as discrimination and racism are concerned. And then there's also generational stuff. If you would have been kicked out, or if someone else decided to do that and they were kicked out, like that can be like a lifelong scar that someone holds because they were rejected by their family.
Often
Um,
is.
why is it that you think families will allow this toxic behavior and abuse to go unaddressed for generations?
Yeah. I think that there's a lot of stigma and shame. And when we talk about stigma, we're talking about these really messed up narratives that we have against different groups, right? And that includes, you know, includes gay and bisexual and people in the LGBT community. But I think there's sometimes these stigmas around what it means to have been abused or to even have been an abuser, right?
Mm,
To for so I think sometimes people are confronted like later on down, like I've had clients who've like talked to their parents about, kicking them out in their behavior, and like there can be a lot of defensiveness like around it, right? Because it's now that shame. That's something that I have to hide. Like I kick my own kid out of the
Mm.
house. And instead of kind of doing the reparative work, sometimes there's like this desire to just avoid. Oh, that kind of, all of the things. I heard it, but and so I think sometimes there can be that. I think also um, shame and the stigma and the resulting shame can impact disclosure of different things of abuse. So like some people feeling like they, being gay was something that they shouldn't have done, and it was their fault that they got kicked out of the house. They should have done something different. And I think also sometimes like the stigma and shame around some of these patterns and toxic behaviors, that you mentioned, can impact people's self-efficacy around getting things about whether if I do something, is that actually going to help the situation, right? So if I, decide to address this or talk, am I going to be heard? Am I going to get what I need? Is the situation actually going to change? And sometimes we tell ourselves that no. And sometimes the world tells us like no, like nothing. Speaking of, the layers, um, you know, sometimes the world is telling you you don't have a lot of control over your environment, especially when you think about things like socioeconomic position and, people trying to kind of move up in the world, and every time they're hitting different barriers, like that just doesn't happen in a vacuum in terms of like you trying to move up economically. It also, the brain like starts to, this is the way that life is like no matter what you do, things will never change. And so I
Mm.
think that shame and stigma kind of promotes a lot of avoidance behaviors on both ends that don't allow the space for some of these things to be addressed.
And then also, I think if there is a power dynamic to where speaking up could result in punishment,
Mm-hmm,
like you
mm-hmm,
learn also that it's not safe for you to even talk about the abuse,
mm-hmm.
and that's another layer. You know,
Yeah.
it can be
And sometimes,
complicated and it can be challenging. Yeah,
yeah. And, I don't want to discount that. Like, I could have been kicked out, right?
right.
Like, these things happen. We don't, like, and so, but sometimes, like, especially when things like that do happen, the brain just goes into protective mode. Like, this is what's always going to happen. So instead of like problem solving or doing it, it shuts all of that down and just goes to like the avoidance behaviors.
Yeah, you go to your default mode network. I've heard of
Mm-hmm,
that mentioned by
mm-hmm.
some neuroscientists. It's like that baseline of this is what we have to do to stay safe.
Yeah,
And if you operate there for a long time, it just becomes, second nature.
yeah, exactly.
Yeah. All right, so a personal question for you. Has
Mm-hmm.
being a black gay man presented obstacles and challenges that affected your mental and emotional health?
Oh yeah. It's like you're subjected to kind of like the triple stigma, right? You're stigmatized for being gay,
Mhm.
stigmatized for being black, as you do it, and then you're stigmatized for being black and gay, right?
Oof.
So I think, remember prom night, I was so excited to be able to come out. I was like, now I'm going to be able to have those experiences of dating and feeling beautiful and, and feeling loved, by somebody outside of my family. And I got a wake up call. It was,
Mhm.
I can remember being very disillusioned, feeling very disillusioned by what I saw in the community, in terms of like racism. So I, you know, early experiences of like using phone apps to date and meet people and stuff like that, Grindr or whatever. Um, you see profiles. I remember seeing profiles that was like no blacks, and I was just like, wow, like what is that? And at first, are people really putting that in their profile? Like no blacks, things like no Asians, no fat people, like stuff like that. And again, it was like this thing of, and then like you marketing materials, right? You're looking at magazines, you're looking at club promo flyers, and not often seeing a person of my skin tone, right? And seeing white people. Now, when I did see people with my skin tone, it was always stuff related to like HIV and STIs and stuff like that. So it was like, wow, like what am I supposed to take from this? You know, like no blacks. I don't see, black people on promotional materials or things like that. When I go to the clubs, they're not playing like black music unless it's like really popular, Beyonce, stuff like that.
Mhm.
Very poppy kind of stuff. And so it's like feeling like, where is my place here? And um, having like lots of discussions about like, people like Harvey Milk and stuff like that, but never really hearing about like Bayard Rustin, who was a major like civil rights leader who was also gay. And so there's like this erasure sometimes, and wondering like cultural erasure and like erasure, and like wondering where it is that you sort of fit in. And I think all of these types of experiences sometimes can make people, again, it's like there's something wrong with who I am, right? And it makes people kind of do this, and me even, do kind of these avoidance behaviors. Oh, I need to like change my body, or I need to like work out more, so that I can fit into this image of like this tall, muscular, like that's the image that I felt like people wanted me to fit into. And so sometimes all the avoidance and all the things that we do to try and get there is what kind of creates, some of those issues. So I think like when you think about, and perfectionism, right? Because there's this constant scanning. Like it's like, do I fit in? Do I fit in? What do I need to do to fit in? And that's where you just the scanning alone, right? If especially as it pertains to body states, is like a precursor to panic, right? The
Mhm.
scanning for threats alone around something that might be uncertain is a precursor to generalized anxiety. Um, and discomfort with different body states in terms of when you are feeling shame or when you are feeling anxious, sometimes can lead people into substance use and attempts to like control their internal body state. So I think, you know, that's been a thing, but I also say that if we have a lot of these intersectional stigmas, we also have intersectional resilience. So, I think problem solving ability. I mean, Black people, we are like excellent problem solvers. Acceptance. I mean, we are the first people to say it is what it is, and we kind of like, figure it out and go from there. That's something. And then community building. The fact that we have cousins that aren't our cousins, but it's that idea of like I can create these really strong bonds with you that are like friendship, even or that are like family, even though we don't have blood ties. And I think that community building and acceptance and all of those types of tools of resilience are what have allowed me need to like come out of the other side. And that's something that, I really want to help highlight as well, because I think sometimes we just focus on all of the bad things and all of the things that are wrong with us. And we also have the world telling us everything that's, yeah, HIV, blood pressure, heart, cardiovascular disease, all of the obesity, and not really telling us or embracing the things about us that are actually that have allowed us to make it to where we are, despite repeated attempts to subjugate us and keep us down.
Thank you for that. Man, you said a lot there. And I think the fact that we are problem solvers, I mean, if you were only given problems, I mean, what else really can you do? And I think that's kind of been our plight is we were thrown into the fire and said, "Okay, figure it out," while these people are not in the fire, and we want you to basically accept that as the starting point that's fair, you know? And I always think about if we did have a fair starting point, like, be light years.
Light
And
years.
even and it's funny because even feeling that way, I feel, like, wrong to voice that, and I guess that's just another layer of discrimination, because it almost feels like you should be happy for what you have and where you are.
Hmm.
And okay, but also no. You know what I mean?
Yeah,
There's so much more to it, but like it makes other people uncomfortable when you talk about I guess the challenges that you've had because it's like, "Oh, that was so long ago." Everybody is blah blah blah, and to keep speaking about it, I feel like it does make other people uncomfortable, but at the same time, like it doesn't it doesn't erase the fact that it happened or
it
that it's
happened.
reality. Like,
Exactly. We're not going to deny reality. And like, there's this new, I don't know if you're seeing it too, but there's just this new breed of that where people have gotten a little bit smarter and they're like, oh, I'm not supposed to say that. You know what? I have no idea what it's like for you to be black. I'll never know that. And it's like really, like you have theory of mind, okay, and there's our common human, you do have the common human experience of being treated differently for something that you can't control. So you just take that and you dial it up as if like you had to live like this every day, and that was part of your everyday life that affected your career, your romantic relationships, your friendships, all of those things. And you can kind of get a sense of what we're dealing with. So I know everyone else on the soapbox, but I'm like, some people say that. I'm just like, oh my God, just like go away.
I remember after January 6th and the people who were there, they were having their moment or their day in court, and they were complaining because of how unfair it was to be locked up, or that their lives would have to change, or that they would have to be accountable for their actions. And I was just like, "Are you kidding me?" And to see it was it was
Yes.
comical. It was
Yes.
comical and painful all in one. And I think for the first time, a lot of people had a dose of reality of
Mhm.
this is what it's like
Mhm.
to have to deal with being accountable for your actions. Now imagine if those actions aren't storming the Capitol and putting your feet up on somebody's desk, but just being black.
Mhm. Walking down the street.
And that is a conversation that can't even be grasped. Like if you're struggling with being accountable for what you actually did. Imagine that. That could
Oh
be
my
a completely separate podcast.
no. I mean, I had a similar when I was because my my course that I'm designing has a lot to do with addressing shame and like rejection sensitivity. And there was this book that was published called The Velvet Rage that a lot of
Mm,
gay people read that kind of focused on the same thing. And there was just this part where it kind of seemed like it was starting to paint this as like, oh, only gay, it's a unique stressor that only gay men have. And like, oh, I was like, this is like written by a white person. I know this is written by a white person because only, oh, my plight. Nobody knows what I've gone through. And like, this is also something that Black people live every
every
day.
day.
And, I think it's something that fat people live. It's something that people with different disabilities live. It's, so that that I felt a similar sentiment. Like, oh, well, it's me.
Yeah, indeed. So you've taken all of this and you've chosen to help people,
Hmm.
and you've done it by becoming a therapist.
Hmm.
How long have you been a therapist, and what would you say your experience has been as a therapist, personally and professionally?
Yeah, so I became licensed as a psychologist 2021. That was when I launched my private practice. It was like COVID wanted to do everything. Um, but I've been seeing patients since 2013. So, and I trained in behavioral medicine. So, what that has to do with is like a lot of times people with chronic illnesses, so like cancer, diabetes, and helping them who also have some sort of comorbid mental health thing going on that's interfering with, maybe medication adherence, for example. So, um, the thing about that is like we often work in hospital settings. So it was actually really great training because you never knew what you were going to see that day. It was like, can you see Mr. So and so? You know, the doctor says he's depressed or something, needs help, and so kind of read about the patient. And then you have to have an idea of different quick strategies that you can use to give them sometimes what they need for that day, what they need for that week. Um, and so what that gave me was a lot of knowledge in trans diagnostic techniques. So like things that you can use regardless of what bucket you're fitting in, anxiety, depression, obsessive compulsive, things like that. And outside of that, I saw a lot of patients in clinical research. So my clinical research was mostly focused in gay and bisexual men, around HIV. So I worked for a long time helping people to treat trauma related to childhood sexual abuse and kind of the sequelae from that to help them feel more empowered to protect themselves in sexual situations. And then, I kind of really decided, I want to help. I think this is an issue, especially in the Black community as well. Feeling like at times we can't protect ourselves or feeling distrustful of different things for good reason. And so I really wanted to design my own program and got funding from like NIH to do that. Um, but over the years, it was just also this like these attacks. Like I remember, for example, in graduate school, it's like every person who stuck out and was not like the cookie cutter psychologist, there was something that they wanted to nail you on. And I remember I got pulled into my supervisor's office and got the message that like, oh, your clinical skills are great, you're doing great clinically, But there was like a conversation at a faculty meeting about like some of the clothes that you wear. Some of the shirts, they fit a little tight, and these were actual like movement. Oh, it fits a little tight, and
Wow.
you know, there's concerns that like it may be like affecting like we want to present a good image and this and that, and it was just I was like, oh my god, this is like my turn to experience this.
Mm,
Okay, so things like that, where I felt like when later I felt like when is it going to be okay to be me, right?
mm,
Like when is it going to be okay for me to kind of be authentic and not have to hide anymore. And so that was a big driver of me kind of leaving the field of academia. And, I wanted to work on projects in which I had ownership, right? Like, technically, when I get those grants and stuff like that, like, the institution owns all of that, right?
mm,
So, it was just like another thing for me of like this almost like ancestral calling of like you need to like own something. And so that's
mm,
why I really started my private practice. And when I left, I was like, I don't think that my desire to help Black, gay, and bisexual men is going to die. It's just not going to look like this. It's going to happen in the context of my own business. Um, and so that's what I've been doing and been on my branding journey. And I think I'm really centering in on that stigma and rejection sensitivity component. Like I kind of started off with social anxiety because that was something, but I think it's kind of led me to this point of really feeling like that was the core. Like with social anxiety, we think about we're sensitive to rejection, right? We are like constantly scanning to see if we're going to be rejected and things like that. And I think that's why I started there. And now I'm realizing that I think this is the direction that I want to go in. Also, making therapy a little bit more accessible for us. So that's, I think, why e-courses and things like that, and why I started on social media and trying to make videos there. It's kind of all designed to like make therapy a little bit more accessible for us.
Do you think that well, first of all, thank you for sharing that.
Mhm.
Do you think that therapy is difficult to begin, period, but then also for, like, people who are fighting uphill? Like, so for instance, if a Black gay man saw you talking about therapy and that you were a therapist, would it be easier then for him to reach out to you? Or, any scenario? Is therapy hard to start, and is there more relatability if you can find a therapist that can relate to your personal situation?
Mhm. Yeah, therapy can be really difficult to start. Um, like you were saying in the beginning, Black people were like oil and water with therapy. And I think, it comes down to, again, this idea of like, if I try to do something, is that actually going to help? Because I've had so many experiences. A lot of us have had so many experiences of like trying, and then like there's some wall that happens, and you can't get through to the next level. And it's not you, though you're made to think it's you, but it's not you. It's structural stuff. And so I think and then there's a lot of stigma and shame again, right? Like of what it means to be depressed. Oh, just get up. Like you're just having a bad day. Like you're anxious. You're anxious about what? I got a million anxieties and I just push through them. And so I think the stigma and shame around sometimes the can make it around mental health and admitting that something is wrong and that we are strong people, but we have moments where we need help.
Mm.
um, are makes it difficult to like start that process. And then I think it's compounded by like, okay, now I've decided, but like I want to find somebody relatable, and you're seeing like nobody that looks like you. Um, and you're kind of wondering like, okay, like how is this person going to help me? And feeling kind of, and again, that's a structural thing, right? There's less access to opportunities sometimes for Black people to pursue PhDs and complete them.
Mm.
So I think those things sort of combined make that process difficult, and it doesn't stop at just the starting. Even continuing sometimes is very difficult because it's like your environment. You're trying to move here, but the environment is trying to like push you back to where you were. But I think back to kind of our resilience factors and kind of our problem. I think sometimes we need to lean into that a little bit more. We are excellent problem solvers, and sometimes therapy, really is a great solution. And the thing about when you do problem solving is the first solution doesn't always work out. So the first therapist you
Mm.
see may suck, but that doesn't mean that you stop. You keep going the way that our ancestors have, and that's what allowed us to be here, is because they kept going and they were persistent. Because there are people out there who understand you. Some of them look like you, and some of them don't. And there are people out there that kind of suck and will gaslight the crap out of you, and some of them look like you, and some of them
Mm.
don't.
I think that's an important fact to recognize, is that just because someone is a therapist doesn't mean they're going to be a good therapist. Because just because somebody can cook doesn't mean the food is going to
Mhm.
be good. Or
Oh, yeah.
or just because someone is a mechanic doesn't mean that they're going to do a good job fixing your car. And I think a lot of times when we associate being vulnerable with someone and telling them something, we automatically want for them to be able to receive that and to help us or fix us.
Hmm.
But it's not always the case. Sometimes you have to see a good number of therapists before you find your fit.
Yep. Yeah, exactly.
Indeed.
Um, and that's, again, that like perseverance of like going through problem solving and kind of, reworking solutions and stuff like that.
For you, what is your goal of therapy when you're working with a new client?
Yeah. So Um, I work collaboratively with my clients to like, what is important to you, because you have X amount of years being you, and I just met you in this session. But a few things are important to me just generally. I think I want people to understand sometimes how much that like your what you're going through has nothing to, has almost it has little to do with you than you think, and a lot of it is structural things and things that have happened. This kind of led to this, led to this, led to this, because I think with mental health, especially because it is such a personal experience that people go through, there's a tendency to like have this self blame, like this is my fault, I'm going through this, I need to go through this alone, and I don't want people to feel that way. One of the things that got me into doing therapy and wanting to do therapy with other people is that I had an HIV scare in college, where I had been sexually involved with somebody, and they later revealed that they had HIV, and I was like terrified. This was back in the days where you had to wait for 3 months to get tested. And I was, looking up the symptoms, of course, like, swollen lymph nodes, you're feeling this way, you know, and I started experiencing all of that. I was getting swollen lymph nodes. I was, feeling really tired. I was getting sick a lot. And I eventually tested negative, but like the experience of that wasn't lost on me. It was like, why was I know I wasn't making this up. My throat was huge. I was getting sick a lot. And it was that idea of stress. And I felt super alone during that time. And I just never wanted anybody to feel that way. And so that's a big goal of mine in therapy, is not to make people feel like they're alone. And then I think another goal of mine is to get people to start to commit to doing something that might change the fabric of that outer level macro factors that might be contributing to different mental health things. So like capitalism, patriarchy, all of those big things. Like, what's your small piece? You're not going to tackle it all, and
Right.
it's not your responsibility to. But like, what's your little piece that you can sort of do to start to unravel that? Because part of that is what led you here. And so I think if we all do our little part, right, that's when we start to really make change and sort of unravel. So that's what I kind of impress upon clients.
I think that's great. Especially because there's a community that can feel relatability to you.
Mhm.
Um, and because you've lived it, you have the experience to be able to allow someone not to feel alone if they open up to you. Especially I think with discrimination. And also I think as we've been talking about, it's safe to say that discrimination is not something new for people of color, or those who've been marginalized. And to start therapy for people who have had to deal with these things, it could be a little bit harder. Um, have you seen a different component of discrimination in the Black LGBT community?
Um, like specifically Black LGBT people.
Well, I remember you mentioned that there's three different types of discriminations for you. There's being black, being a gay black man, and then being a black gay black man. So
Yeah,
is that something that is also part of the Black LGBT community as well?
yeah. So I think I kind of talked about one sometimes this expectation to fit into this very like yoked out black guy, you know, and kind of all of that. But I think one thing that's kind of pretty insidious in our community is like internalized homophobia. And
Mm,
so when I think through repeated kind of trying to suppress different aspects of yourself because there's like this shameful component, can actually start to like develop more into like a hatred of those little things, both in yourself and in other people. And I think it's something that is really unfortunate because, especially for us, community is so important. And so
mhm.
when we are like further segmenting ourselves into, oh, yeah, I'm gay, but I'm not like feminine like you. I don't dress like that, or I act like a man, and that kind of thing. It just further segments us and allows other people to just pick us off really easily. And so, I think it's super important to address that inner like kind of rejection sensitivity, because it actually impacts the things that make us resilient, the gifts that our ancestors kind of gave us of like community building, and stuff like that. So I think that's one thing that I find particularly sometimes insidious, and it's understandable. Like, we are we're, like I said, we're facing those three different stigmas. And so in the Black community, you know, it's not, being gay is different and more complex than it is in the white community. And so um, I think being able to, it's understandable why then somebody would be more, go to more of that internalized homophobia and things like that, because they're trying to survive. The
Yeah.
consequences and things are different. If you, some people, it's like you get kicked out of the home as like a white person. I think it's a little bit different than being kicked out of the home as a Black person and now being able to, and facing the world alone. I don't think we have to say that either one is like worse or better than but like they're different.
Yeah.
And
They're
I
both
think being
bad.
Black,
Yeah.
yeah, they're both bad. And I think being Black adds a layer of complexity to navigating all of that. You're going into medical settings, trying to navigate government, kind of like offices and get services that you need. That experience is different, I think, when you are Black versus when you are white. So, to avoid all of that, I think people sometimes go into that like, okay, I'm gay, but like, how can I like separate myself from, that, all of the stigma stuff? And that's where I think the internalized homophobia can come in.
That's a lot to want to be who you are, but to have to choose which little tidbits
Mhm.
will allow for you to like survive or make it in the
Yeah.
world. And I the what I was thinking about when you were mentioning that is like how a lot of dark skinned people will bleach their skin so they're
Just like that.
lighter, but you're still black, but
Yeah.
like you're not black,
Yeah.
which the just the concept of doing something that can make you a lighter version that will now open doors for you, that in and of itself is just so heavy. And to have that layer of being black and then also being gay but not wanting to be, I guess, gay.
Mhm.
Ugh.
Mhm. And it's like this in cognitive behavioral therapy. There's all these unhelpful thinking styles and stuff like that. And there's one that I think of as like a yellow flag thinking style that you have to watch out for, is like this reclassification or like
Mm,
comparison and reclassification. It's like, I'm Black, but I don't talk like that. Like or like, I'm Black, but I'm educated. And it's like, okay, so what are you saying? And so it just further segments communities, which are already, we have people trying to like pick us off, and so it just further helps that cause, and that's just not something that we want to do. And so we want to be careful of how we're using that, and be aware of why we're using that. Like you're scared
mm.
of the potential consequences of rejection, and that's okay. Um, but it's how you deal with that, and is the way that you're dealing with it really helping you? It may be helping you short term, but long
Right.
term, is it helping you? Long term, is it helping us?
I think getting to that root cause of fear is difficult because in order to do that, you have to let go of some of the armor that's
Mm-hmm.
protecting whatever vulnerability is in there or whatever hurt and pain that
Yes.
that caused the armor to begin with.
Yeah.
And I think people will do as much as they can to remain armored up,
Yep. Yep.
even if it doesn't serve them, you
Yep.
know? And I think that's why having these conversations and going to see a therapist is important because you understand your reasons and you understand your whys, but also still living in a world where you're being discriminated against or you're a minority is difficult. And I wanted to touch on um, the difference between being a minority and being minoritized. Can you kind of separate the two?
Yeah. So, minority refers, more to like numbers, right? So I was a minority in my psychology program because there were one or two black people and the rest were, of other races. So, but when we say minoritized, it it makes people accountable for why we even need to use the term minority in the first place. I'm called a minority because there are less black people in this doctoral program, but there are things that led up to that, right?
Mm,
There's systemic things that are that have and continue to um, hinder black people from pursuing PhDs and also from completing them. Like, I think that's something that we don't talk about a lot is like, you know, that kind of that I went through with the you're dressed to this and that. Like, those are things that like make people leave these programs early and don't complete them because it's just like, what the hell am I here for? I've wanted to help people, but I'm just getting, stabbed in the neck at every turn. So um, I think when we say minoritized, it's pointing to there are causes for why I am here in lesser numbers and why we need to use this term minoritized in the first place. And it holds people accountable, I think, for changing those things.
mm. I think a lot of what we've discussed so far could be classified as trauma. And a lot of people are talking about trauma now, what it is, what it isn't, etc. In your professional opinion, how would you define trauma?
Yeah. So with the Instagram now, I was just talking about this with a friend yesterday. How like sometimes like as professionals, like we're so afraid to like post things, but Joe Schmo is talking about trauma and has no experience in mental health. But I define trauma more as like anything that affects the way that you view yourself, other people, or the world in a way that is often negative and unhelpful. And it tends to hit in a few key areas. So, power and control, safety, it impacts your ability to trust, intimacy, and your self esteem. So, we see a lot of times people after traumatic events, I can't trust anybody, right? It's the brain once again kind of like shutting down, trying to protect you. But like, some people can be trusted is not, it's too complicated. It's 0 or 1 binary,
Mm,
right? And, you know, that also happens in the body, right? The body stays kind of like keyed up and on edge, like I'm waiting for that. And then the body, we know that the brain communicates to the body, tells your arm to move or whatever, but the body also communicates back to the brain. And so when we're carrying that like keyed up energy and things like that, it's like confirming all of those thoughts that this person's going to hurt you. You can't trust people. You are like damaged goods. You're not lovable. Things like that. And I think you've had like epigenetics people on here and things like that. And so you think about like we're carrying that on for years and years and years. How is that changing us? Like, what is our body trying to do to adapt to this like trauma world, right? And how am I passing that on, right? And like, think about things that are happening there. So really, it's like those changes that are very negative, that tend to be very global and sweeping. And that's how and I think of like things like you said, like because sometimes people say, oh, this isn't trauma because it wasn't like you were killed or you saw somebody killed or things like that. But yeah, one thing is intensity, but like another thing is like duration, right? And
Mm.
like things just happening repeatedly, which it triggers learning. Like learning is through repetition, right? And so that is also those are also events. And so I think a lot of the stuff around like complex trauma and stuff like that is to kind of give acknowledgement to those experiences. But when somebody comes into my office and we're talking about things like this, I consider it trauma, and so we process it as such, to help identify what those narratives are that are playing in people's head, because they're going to get triggered again. This wasn't just in the past. Like, we know that these situations continue and that stigma continues and all of that. So you got to be able to catch it, kind of change, make your thinking adaptive, and make your behaviors adaptive, so that you're helping yourself, both short term and long term.
That can be hard though to so I've heard once that most people in therapy are in therapy because of their family members and community that aren't in therapy.
Mm,
So if you're in therapy trying to learn about your behaviors and the different types of adaptive mechanisms or whatever, what have you, that you may be using to survive, and you learn some techniques and tools, but then you have to go back into this unhealthy environment. I mean, that can almost be impossible.
yep. Um, it feels like you're moving backwards, right? Like, and so I think that demonstrates the importance of environment and where
Mm.
you're spending your time. And I always say, like, when people are doing this work, this is a journey, and not everybody can go on this journey with you. We're going into warp speed, and on the acceleration, you're gonna lose some people. So, and that doesn't mean that I think people on Instagram sometimes like say that, and it means like push people away, and that's not what we're doing. It's you're moving, and whoever can be on that journey. And that was so I left the United States to move to Brazil, and that was a big reason, is because as a black man, I didn't feel validated the way that I needed to, oftentimes, especially in Boston. That's where I was living, and I knew that it wasn't just a Boston problem. It was like an American problem. I wanted to be able to um, go to clubbing events and things like that without worrying about somebody bringing an assault rifle into the club and hurting people. And so, um, yeah, sometimes you have to change your environment, because the environment is really like a huge component of this. And I think sometimes there's that fear again of like, well, what will I do and this and that, and it's like, well, what's the alternative? What's happening now, and staying put, where you are. Sometimes that is the most effective action, but it's like people don't. Sometimes the fear and things bypasses any problem solving. Right? So you're not
Mm.
even aware of the other solutions. You're just like, this is the safest solution, rather than like, if you map it on paper, maybe this is a 6. Maybe it is kind of a really safe solution, but maybe there's like a 4 and a 5 that could be combined somehow to create an 8, right?
Mm.
And be able to, and it requires you to take that jump, right, and to kind of, courageously move forward and trust in your resilience and to be able to make things work. And so um, that's where I kind of am right now, especially with my move.
I think making the choice to get healthy um it's kind of all encompassing because if you think about it from a different perspective, right? Let's say everybody in your house has the flu and you may have had it first and now you're recovering. So you leave the house until everybody else gets better, but there's just this constant reinfecting that's happening in the house.
Mm-hmm.
If you want to be healthy, you can't be in the house.
Mm-hmm.
And that doesn't mean that you don't love the people in the house or that you don't want to help them or that you don't care about them. It just means you don't want to be sick. And a
Exactly.
lot of times it's too difficult for us because we put so much onus on I have to help my family members or I have to help my friends or I have to make sure that these people who came up with me or who have always been there for me or who will ride or die for me
Mm-hmm.
that I have
Mm-hmm.
to be that same type of person, and a lot of times we do it at our own expense, or
Yeah.
and whether it's our and we don't even know about mental and emotional health. We just think no matter what, blood is thicker than water, or
Yep.
you do whatever you have to do for your people, and I think that mindset is what keeps us stuck. And when people do decide to leave the house because they don't want to be in that constant state of infection, then the guilt starts to come in, and
Yep.
it's hard. It is so hard because I don't think we've ever learned how to choose ourselves in a healthy
Mm-hmm.
way because if you choose you, it has nothing to do with anybody else.
Mm-hmm.
Like if you choose to be healthy, that decision is your decision and how other people feel about it doesn't impact you, but we put more emphasis on how other people feel about it than
Yep.
actually being healthy.
Yep. And it's almost like sometimes we try to change the way that other people feel about it. Like you got to learn this, like I've in therapy, we're talking about that. You need to do, and it's like we're stepping outside of our boundaries, right?
Mm.
Like boundaries are supposed to like be like you control your behavior, but you trying to like control other people's behavior and tell them what they need to be doing to get it. It often does not work. And so,
Well, boundaries are so threatening to dysfunction because if
mhm,
you set a boundary, that means that now you're changing or you're different
mhm,
or,
mhm,
you know, and I've heard it said that boundaries don't create conflicts, they expose underlying conflicts that were never brought to the surface. And I was just like,
mm,
wow,
yeah,
that is so true. But especially with parents, like and especially in black families, like you set a
mhm,
boundary, you're being disrespectful.
yeah, yeah,
And I think that may be because the adults in our community or in our family systems have never really had to accept the fact that their power can be challenged, even if they're wrong. So a child having autonomy or wanting to have some sort of separation reflects negatively on them. Like when we go to church, or where's whatever the name is,
mhm,
but he decided he didn't want to come to church anymore. He decided he's
mhm,
going to do this and do that. That makes the family look bad, and there can
mhm,
be nothing that makes the family look bad.
mhm. Yep, yep,
So battling all these things and trying to do something that gets you to a point to where you have a sense of just peace or where your nervous system isn't constantly on 10 is difficult, and it can create anxiety. And a
mhm,
lot of us may not have even known what anxiety was because we were just always on 10. So we
mhm,
got used to the adrenaline and these feelings of things being so tense and having to happen in a certain way that when we try to actually relax, like we can't be comfortable in safety because we only feel safe being anxious.
Yep. Yep. And you think about like our ancestors and what they went through, and like, there was no opportunity to like voice what you felt. It was, you needed to
Mhm,
be in line with this. And if you didn't, the consequences were grave, right? Which would cause, this high level of emotion, right? And so fast forward, many years, it's like, I think there still is this like higher emotional reactivity to like feeling powerless
mm,
and feeling like your your will or your whatever is being threatened, right?
mhm,
Um, of course, we're not afraid of the same consequences, but it's still like that emotional reactivity to it. And I think it's amazing now that we can label some of that as like anxiety, and
right,
we can label some of that as things that are treatable, because we can treat anxiety, and we can quickly, and we can do these things now. So I think it opens the door for us to heal.
mm. Well, you specialize in anxiety and depression, and I wanted to ask you, how do these conditions manifest, and what can they look like for someone who is functional versus someone who can't function as well?
Yeah. So I think, and especially with what we've been talking about in terms of like minority stress, right? So like you can think of, for example, little kid who, Johnny, whatever,
Mm,
16 years old, wants to do gymnastics, um, and tells his parents that he wants to do gymnastics. Parents say, "Oh, that's for girls. Are you gay? Like, what's going on?" He becomes really afraid, right? That maybe he's going to get kicked out of the house, otherwise rejected, and the consequences of that will be grave. It creates this fear. It creates shame.
mm,
And then it leads to these avoidance behaviors. Now, the avoidance behaviors can, I think, be a determining factor in where you kind of end up. So Johnny may kind of decide, oh, I'm not really gonna do anything related to gymnastics. In fact, I'm gonna like remove all of the things that are related to gymnastics. And over time, that starts to become programmed, right? So like, that's my avoidance thing, to just hide this, right? And so you start removing activities that you really enjoy, right? What is that? Depression, right?
mhm,
Or you kind of do it, but you're kind of doing it in secret, right? And you're constantly having to scan to make sure that like nobody's, gonna find out, and things like that. So you're doing this, um, you're developing this kind of like fear of like what might happen, and this fear of kind of the uncertain, which is like generalized anxiety, right? And be fearful of like what other people might think. So that can kind of lead to like social anxiety as you do more and more of this like avoidance. Um, and so I think and some people we know function, there's this like functioning anxiety and that term and stuff like that, where it's not interfering with their lives in a conscious way. So like sometimes you see people who like, oh, I'm going to do gymnastics, but I'm going to be the best gymnast that you've ever seen. There's no room for mistakes. Like I'm going to
mm.
take home all the trophies. I might even like sleep with girls just to show that I'm like a jock, this kind of thing. Um,
It's a
and
bigger
so
issue.
here, yeah, right. This appears to be functioning like every best gymnast, but what's going on behind the scenes? It's still avoidance, because
Right.
you reacted that way to avoid stigma. You decided you were going to be the best, so that no one could stigmatize you, right? So yes, it's functioning, but it's still you're still buying into that narrative that you can't handle stigma, you can't handle people like, doing rejection. Um, and you also sensitize yourself over the years to rejection. So that moment when you don't win, you don't get that trophy, that's going to be a really difficult moment.
I remember I heard you talk about safety behaviors, and
Mm-hmm.
I remember how intriguing that was. So I wanted to ask you, what are safety behaviors, and how can they prevent relief from anxiety? And
Yeah,
you may have
that's a
just
good.
you may have just talked about that a
Yeah,
little bit. So
yeah. That would be an example. Safety behaviors are those things that we do to like we face the fear, but we don't really face the fear, right? So in that example, it's like it seems like he faced the fear, like I could be rejected, but he didn't really because he decided he was going to be the best. So it's like if you are afraid of dogs, right, and you have to walk by this fence that has a dog that runs by and screams or barks, but you decide, all right, I'm going to confront my fear, but I'm going to bring my knife just in case that dog like hops over the fence. Um, you confronting it, but not really, because you're doing something to make yourself feel safer. So you're bringing that knife in case something happens. So what happens when you don't have your knife, right? The fear's gonna rebound. And so long term, you don't do much. The anxiety just changes, but it doesn't really go away. It just kind of changes shape like Tetris to fit into whatever, is going on now. So, benzos that people use are a common thing that are often safety behaviors. So like Xanax, Ativan to get on flights. I can get on the flight if I have my Xanax or my Ativan, right? And so,
you're not even really on the flight because you're
you,
you're out of it.
mm-hmm,
And
you're not
if
present.
yeah, if so and I think a safety behavior is, I would say, anything that can take you out of being present
Yep.
in a situation where there is anxiety.
Yeah. It keeps you from feeling the feeling,
Mm.
right? The feeling of anxiety, because that's what you end up sensitizing yourself to. So the next time that feeling comes up, could be in a different situation, it's going to be more intense because you've been avoiding it all of this time by not being
I didn't realize that feeling our feelings was such a big thing, but
present.
as a,
Yes.
as a black child growing up and then, developing into a black man, like, we don't feel our feelings. We do everything to avoid feeling our feelings, and then once you actually have to feel them after you've been avoiding them for 30 years, they are so big that they will literally engulf you. And when you have to sit in those feelings, you have
Mm-hmm.
no clue what reality is or what's going
Mm-hmm.
on. And um I think being present and doing something that will prevent safety behaviors, you might have to do it little by little, because if
You
you
always do. Yeah.
if you try to go into a big feeling that you've been avoiding your whole life, it's like jumping off a cliff.
Mm-hmm.
So
Mm-hmm.
what are some ways, I guess, to microdose feeling your feelings?
Yeah. So we often use like these. Um, so one thing that I do sometimes is like emotional exposures. So like if somebody has a problem with anger, for example, right?
Mhm.
We um, we don't go to like, oh, that moment that made you like nuclear and like, think about that. No, think about like a minor inconvenience, right? And can we practice sort of relaxing in the context of that? And when I say relaxing, I more mean redirecting because there's like this, I think when people hear relaxation, they feel like they need to be in like this Zen state and like, and it's just people practice this their whole lives, and
Mm.
it takes that kind of discipline to get there. So let's not like If that happens, fine, great. But let's focus more on redirecting, because what we know about what underlies a lot of these things is like an attentional bias, right? So when situations make people really intensely angry and it doesn't really fit the facts, it's a lot of times because there's an attentional bias to like everything that's unfair about the situation, everything that's being done to like persecute you, versus looking at the situation as a whole, right? And being, once again, being present, right? You're not being present to the whole situation. You're just being present on things that like are going to inflame your anger, right? And so, and then dialing up those situations. Was a situation that made you a little bit more angrier? It wasn't like a minor inconvenience, but you kind of thought about it for a little bit after, and you were like, you know,
Mm.
like, let's try to relax through that. Now, like, what's that situation that's like you kind of still think about it to this day, but you can move on, and we go through that. And then, like, what's that situation today of like, that pisses you off, to that point, and then we work on redirection and relaxation around that. So it's like this systematic kind of, and we build that hierarchy together in session, and like what that looks like, so that you have an idea of like what we're going to be working through.
Nice. There was
Yeah.
something else that I saw that you mentioned, and it was associated with feelings,
Mm-hmm.
and it was emotional reasoning.
Mm.
And when you explained it, I was just like, "Oh my goodness," because it made so much sense, and
Mm-hmm.
it also helped me see that a lot of times we may not be dealing in a true sense of reality. It may
Mm-hmm.
be that we're being led by our feelings. So I wanted to ask you if you could explain what emotional reasoning is and how it's associated also with anxiety.
Yeah. So when we emotionally reason, um, we treat our emotions as the facts, right? I feel like there's something that you're doing that's shady, so it must be that you're doing something shady. I feel like embarrassed, so therefore I must be an embarrassing person. That must have been a terrible performance. Things like that. And so one thing um, that we often do, especially in social anxiety, is like exactly what I just said of like, and it's called post event processing. So like they'll take an event after the event, they're sitting in their car, they're in the Uber or
Mm.
whatever, thinking like, oh my god, they're going off of that feeling of embarrassment, right? Because they've exposed themselves to something that they're fearful of, but they're using only that feeling to reason. So that feeling is communicating to the brain something's wrong. Something's wrong. So in their post event processing, when they're thinking about everything that happened, it's like that it's communicating something's wrong. Like when you said that, oh, you should have said that instead, right? Oh, why did you not ask them to if they wanted to do something after the event? Oh, they probably thought you were so awkward for doing that.
Oh.
And so one question is to like just what are the facts? Like what actually happened? Do you have facts to support that? Um, and some people like to also there's this like Socratic questioning. So like, what's the evidence for? And almost act like you're in court. What's the evidence that you would need to convict yourself to like they thought that you were awkward, right? Or they, this kind of thing. And oftentimes there is just no factual evidence. So it's indication that you might be moving more towards like emotional reasoning. So you need to bring in a little bit more facts. And so turning down kind of emotion mind and turning up more of the rational, reasonable mind. And that may require you to, again, do some of the relaxation and redirection of like, and that's why that helps because it will help you to redirect in a faster way. So that while you're in the car, all this is coming up, you can.
One thing I wanted to mention is that, like we spoke about with epigenetics, if emotional reasoning has been something that has been happening in your ancestry for, let's say, 5 generations, and now you're at this party and you wore the shirt that you didn't think you should wear, and people are looking at you, and you think they're looking at you because the shirt is ugly,
Yeah.
but they really like it.
Yeah.
And then you leave early and you're sitting in the Uber and you're doing that, what do you call it? Post
Post
event
event
processing.
process. Yeah.
If all you know is thinking with your feelings or your emotions, it could be very difficult to do
Mhm.
some of these exercises that you're mentioning. So I wanted to just acknowledge that for somebody who says, "Okay, well, yeah, I would love to do that, but it's hard." It is.
Mhm. Mhm.
And you can also
Mhm.
do it.
Yeah. And back to what you mentioned, in the previous question about, we're not allowed to sometimes feel our feelings.
Mhm.
That's where that comes from. We There will be this kind of like backlash into emotion mind because your feelings were always invalidated as when you were younger. So, I mean, we think about our ancestors. I'm tired. I don't want to work today, and like that didn't happen. That was
Mhm.
invalidated, right?
Yeah.
I'm feeling sad today. Okay, right? That was all invalidated, and so it creates then that stronger emotion because emotion mind is now screaming like, "Pay attention to me! Pay attention to me!" Because you've always gone to reasonable mind, and I just have to work. I have to work so that this grave consequence doesn't happen. And I mean, we think about like now it looks different, but we still have those same narratives. So I think
Sure.
and it's really important to allow space for us, um, starting in childhood, to really feel those feelings and talk about them because they will come back up. It's just when,
Right.
and the intensity, and that intensity can be, like you mentioned, monumental and kind of really difficult to address.
Mhm. Thank you for that. And thank
Mm-hmm.
you for this. I mean, we
Thank
have
you.
talked about a lot, and I think we met and exceeded our goal of using this conversation as an opportunity to discuss difficult and uncomfortable topics, including anxiety and discrimination, etc. So I want to circle back to you,
Yes.
and I want to ask you a personal question, and then build off of that. And first, I want to ask you if you could go back and say one thing to little Calvin, what would you say?
I would say that it's not you.
Mm.
All of those things that you're feeling, all of those like negative, um, like that you're powerful, and there's these things that keep telling you that you're not good enough, and um, it's not you. It's your context, and you're gonna break out of that one day and be amazing. And yeah, I think I would really let him know that you're internalizing a lot of things that just do not have anything to do with you, even though they feel like they do. And you are those things about you that you're hiding. Um, it's okay. I understand why you're doing it at this time. You're doing it to survive, but start to find your way to break out of those little things that you're doing to hide, and find little ways that you can start to show yourself, because that's what those messages want. They want you to continue to hide, but um, it's time for you to come up and start to take your place.
I hope little Calvin heard that. All right. Now I want to give you the opportunity to do something that little Calvin may have never had a chance to receive. And I'm going to paint a picture for you. Let's say you're at the supermarket and you see a little brown boy who looks like you, and he's clearly made the choice to be authentic. You can tell that he's carrying an undeserved burden, and his struggles mirror the struggles that you had to deal with at his age. You decide to offer him some comfort and support, and he tells you that he feels unworthy or less than because of what society tells him he's supposed to be and how he's supposed to look. What do you say to him to pass this forward?
I don't even know if I would say anything so much as I would take him and we would go get professional photos done of him in whatever he wanted to wear, whatever he felt like was the most authentic to him. And we would just have so much fun just taking photos and capturing those little bits of joy that he feels when he's being himself. And we would print them so that that was something that he could always take with him as a reminder that he's beautiful, and that there is joy in there. And I would get him a plane ticket just to somewhere where he wanted to go outside of the country, so that he could explore and see that not everybody thinks the same way as the people in your immediate environment. There are people that think that you're capable. There are people that think that you're beautiful, lovable. And I just want you to have a taste of that, because it's going to motivate you to start to be yourself and to really break out of that shell and to be able to start traveling more and have an idea of who you really are, not who your environment is painting you out to be.
I'm sure he would love that.
Mm-hmm.
Thank you for that. All right, last question. If you could use your platform to educate anyone who might be struggling with their mental or emotional health, whether it's as a result of discrimination, childhood trauma, anxiety, depression, etc., and they're uncertain on how or where to start, what do you say to them?
I say to them, start. Um, you are a product of your ancestry, and you are here for a reason. And many of us have had to agree or like go through so many things in order to just like survive and problem solve and figure things out. And so, and our ancestors had to do that, and that's within you. So don't be afraid to just jump in. You can figure your way out, and you can, as things come up, and there are blockages that will come up. You don't like a therapist, the work gets a little bit too intense. Your environment is moving in one direction and you're moving in another. But you have the capability to be able to navigate that. You wouldn't be here right now if you didn't. But it's that fear of starting and that fear of initiating that is holding you back. And that's what you need to kind of desensitize yourself to. You are worth therapy and you are worth doing this work. And there are people out there that want to do the work with you and that will help you immensely. But you have to take that first initial step. And you're worth the investment of time dedication and money um, that it takes to sometimes make this journey.
I think these last three questions have really cemented this entire conversation. It took everything in me not to cry while you were describing what you would do for little Calvin and for the little boy you met in the supermarket. And I was like, not that I have a problem with crying because I cry all the time. Crying for me is like breathing, but it was like, okay, we got to finish this episode. Thank you. A million
No,
thank
thank
yous.
you.
Um,
Um,
if somebody wants to find you on social media or online, where can they find you?
yeah, I'm at Dr. Calvin Fitch. It's Dr. Calvin Fitch on Instagram, and then on TikTok as well. Um, and then also the period model psychologist is my other Instagram, more personal and influence fashions, but it's how I use these skills in my daily life.
Nice. All right. Well, again, I'm grateful for your time. I'm grateful for the work that you've done. I'm grateful that you're willing to be authentically you, to blaze a trail for others who may not know how to be their authentic selves. Um, Thank you for doing this with me. Thank you for who you are. Thank you for what you do. Thank you for how you do it.
Thank you so much.